Cardiac arrhythmias, irregularities in the heartbeat, a medical condition that is becoming more and more common in the U.S. and around the globe. In fact, according to the CDC, the most common sustained arrhythmia is atrial fibrillation, which affects up to 2% to 9% of the people here in the United States. And with cardiac arrhythmias expected to grow in the U.S. based on an aging population and increasing risk factors, one has to wonder if there are any companies out there trying to improve the treatment of cardiac arrhythmias. And that's where NYSE American-listed Ra Medical comes into play. Actually, after a merger in January 2023, that's where Catheter Precision also comes into play. An innovative U.S. medical device company that's looking to bring new solutions to market to improve the treatment of cardiac arrhythmias with a focus on developing groundbreaking technology for electrophysiology procedures by collaborating with physicians and continuously advancing its products. To find out more, I had an exclusive interview with David Jenkins, Ra Medical Executive Chairman on Wall Street, to discuss what Ra Medical is all about.
It was a company. They went public with some laser catheter system, but for a lot of reasons, they decided that that would take too much money to really bring to the market, so they decided to switch gears, make a pivot, and they acquired our private company, which is Catheter Precision, Inc., and we're in the field of cardiac electrophysiology. So still medical devices, but with unique and different stuff. Ra Medical is essentially, when we acquired it, it was an ongoing business, but we've decided to shut down those operations. And moving forward, it is just going to be cardiac products. Interestingly enough, this is my third cardiac electrophysiology company, right? And the very first one we started with the Cardio Lab, that's now being sold by GE, and it's still on the market today after being sold many years ago. My third cardiac electrophysiology company has a couple of unique products. One is a non-invasive way to figure out, before you put catheters into the body, where the arrhythmia is coming from in the ventricle. The ventricular procedures are different from most people have heard of atrial fibrillation, and yeah, I just met two people on the floor of the exchange here that said, oh, I had an AFib ablation, right? And one of them was with a doctor right up here at NYU, a guy named Larry Chinitz. He uses our stuff for the ventricular side of things because you can pinpoint where that arrhythmia originates. You put your catheter in, you ablate, and you're in and out of the procedure in 1 hour, versus 4 hours of hunting and pecking around trying to create, a model of the electrical activation of the heart and finding out where the early activation is. Okay. So it's really something that reduces time, reduces cost because of the time, but then more importantly, it allows the hospital to maybe do another patient during that day, so it increases revenue. Decreases cost, increases revenue. So we think it's a product that's there, and most importantly of all, with any product, it helps patient care and patient outcomes.
So following the merger, one has to wonder, what's the feedback been so far? For that answer, we go back to David Jenkins on Wall Street.
Well, it's actually a pretty new product. We got it approved during COVID. Most hospitals say don't bring anything new in here during COVID, so we needed a little bit of money. We've now, in the merger with the public company Ra Med, we've raised some money around that. We just completed an $8 million offering, so now we have money. We've just hired 5 sales guys in the U.S. We have some new clinical people. So, at this point, it's not like there's 100 hospitals using it. It's pretty small, but those that try it, almost everyone says, I want to buy it, right? And those that buy it, they're using it.
So as the company continues to grow, the question must be asked, what's next for Ra Medical? Once again, here's David Jenkins with that answer.
What we expect is that this non-invasive product, it takes a little bit to get your pipeline going, get customers going, get a lot of feedback from the key opinion leaders. But hopefully by the end of, not this year, but the following year, we'll have a good 50 hospitals in the U.S. using it. And at that point, then you can say we've established not just clinical relevance, but clinical acceptance from all of the physicians. And at that point, it should really be taken off. On top of that, we have a new closure device. So what a closure device is, when you pull the catheters out of the body, you have some blood that's coming out of there, right? You have to stop that thing up. And there's a number of companies that have been in the closure stuff. And we have a new closure device we think is simpler, faster, and a lot less expensive, right? So we think that could actually take over and do quite well, even after just about 1 year on the market. So kind of looking at the end of 24 is really where our milestone is. And at that point, then we figure out, okay, now what do we do with the company? Do we add on some more products and bolt them into to our products? Do we keep specializing in what we're doing, focus on that? Then that we're, that's to be decided, I guess.